The Madison VA's ASHP-accredited PGY-2 Pain Management and Palliative Care Pharmacy residency is the only one of its kind available in the state. There continues to be a need for pain pharmacists, and pain management continues to be a growing field. This residency provides the opportunity to expand on any PGY-1 and give the residents specialized training to set them apart from their colleagues. Last year's graduate had 3 job offers, and he accepted his first choice. The VA system is working hard to ensure that all veterans have access to a pain pharmacist. What I love about practicing in pain management is that I make people safer and more functional. I'm able to make referrals for services like acupuncture, chiropractor, physical therapy, as well as ordering labs and tests. Our facility places a large emphasis on the whole patient, not just a specific complaint. Because mental health comorbidities are so common in this patient population, the resident spends a significant amount of time in the addictions clinic and mental health clinic. They also work closely with interprofessional clinics alongside and learning with physicians, nurses, OTs, PTs, and psychologists. There's opportunity for the resident to repeat learning experiences in the last block or create new ones. Previous examples are the emergency department, oncology clinic, and infectious diseases clinic. A lot of the residency takes place in the ambulatory care setting, so previous experience with note writing is helpful. There's no required staffing component with this, but PGY-2 residents who previously completed their PGY-1 at the Madison VA and were trained as inpatient pharmacists can work occasional weekends. There's also ample opportunity to preset PGY-1 pharmacists and students throughout the year. We also have a leadership program with several leadership trainings throughout. The resident will have the opportunity to work on local and national committees. This is a great way to network and influence changes throughout the whole VA system. We encourage presenting posters at national and local conferences. The resident does present their research project at the Wisconsin Pharmacy Residency Conference in April, as well as to hospital leadership. I'm really passionate about appropriate pain management for our veterans. We are lucky at our facility to have a strong whole health team and excellent leadership support for pharmacist providers. We're able to practice at the top of our license, which you don't get to do everywhere else. No matter where you are in your training, I'd love to talk with you about this opportunity. Please reach out to me. Send me an email, and we'll set up a time to talk.
Okay. Pharmacists at the Madison VA are able to practice at the top of their license. We have a scope of practice, meaning we can prescribe non-controlled substances for our patients. This allows us to spend more time devoted to patient care and less time following up with providers for our recommendations. And this is great because patient care is truly my passion. I chose pain management and palliative care because I love working with patients to help alleviate their suffering, and I also really like being able to approach them with a holistic mindset. I found that working with an interdisciplinary team has really helped to expand upon my knowledge and work on different methods of treating pain management and hospice settings with medications and without medications. Pharmacists are really well-received members here at the Madison VA, and we have several opportunities to work with other healthcare providers. One of my favorite clinics is a multidisciplinary pain clinic where I work alongside a physiatrist, neurologist, psychologist, physical therapist, occupational therapist, and nurse. Every Friday afternoon, we also have an interprofessional seminar, so we work alongside social work interns and psychology interns to help practice our motivational interviewing skills and also review disease state management, mostly focusing on mental health. We also work as a member of the palliative care team, both in an inpatient and outpatient setting. I found that this program offers the perfect balance of autonomy and support. You'll see your own patients from day one, which is great, especially for me, because I learn best when I'm fully immersed in an environment. I've still found that my preceptors are always available at a moment's notice to help answer my questions, so I never feel like I'm alone. And they really enjoy taking the time to teach us and help us grow. I also really like rotating through different clinics each half day because it allows me to stay well balanced and allows me to learn from a variety of different settings in a shorter period of time. Another favorite part of my program is having 17 co-residents. Even though there's so many of us and I'm the only pain management and palliative care resident, I never feel like I'm going through this alone. We're a very close-knit group, and last year we had optional events almost every day or every week during the year. Whether it's having picnics, potlucks, going to concerts or sporting events, or just meeting at the terrace for a bite to eat. overlooking the lake. Even with COVID this year, we've found other ways to meet virtually, whether it's craft nights or themed game nights. So it's really nice to have that support system as well. Overall, this program provides me with an exceptional learning experience, a close support system, and the opportunity to care for our nation's veterans. I could not ask for anything more.